Perfect, thank you. So really excited to be here. Is audio okay?
Yes, we can hear you.
Excellent. So it's been a couple of years since we've been back at AHAP. So very excited to be here today with everybody. And I wanted to first, on behalf of my team at Javari, say thank you. My name is Akshay Birla. I serve as our Chief Marketing Officer, but until a few months ago, I was actually leading our public health and healthcare team, spanning so much of our pandemic response. And so from my personal experience in working with a lot of your colleagues, I've been scrolling through and looking at the names, I've worked with a lot of your colleagues and your partners at the state or local level. And just been so impressed with the work that we've done. And so on behalf of our teams, whether you know us as Javari or Corvina or Knowledge Center or Life Process or Nocera, thank you. You are the unsung protectors of our communities, and it is absolutely inspiring to work with you and serve the communities that you serve. For those of you who don't know us or know us only from our solutions like Webeoc or EM Resource, Javari's mission is to strengthen and optimize information sharing and visualization to empower our communities, preparedness and response professionals as we protect people, property, and brands. And what that means for us as we serve our diverse stakeholder, really three different things. First, we build software that helps you prepare, connect, and respond. Second, we provide services that help you support the use of the software, especially as folks need to configure it to meet your very complicated or nuanced workflows. And then finally, we keep in mind community at the core of what we do. So our platforms truly make our communities more resilient by making it easier for you to share data and connect with each other when the time is appropriate to do so. So just to give you a sense of the Javari community, we welcomed clients who use Live Process and Corvina in the last 18 months. What that means for us is 150 more hospitals at a hospital level relationship than we had 18 months ago. New partnerships with state levels at 5 different states. Utah's starting a statewide implementation, New York, New Jersey. DC has been pretty new to us. So with that, we cover approximately 65 million new constituents. Because of the work that we do for hospitals, in service of that, we established direct partnerships with HHS's Protect Teletracking program, as well as the NHSN program, so that status updates from hospitals could be sent directly without having duplicative data entry. What that means is if you've used EM Resource, for example, we've almost doubled the number of users, increased the number of facilities that are using it by 25%, and a 400% increase in baseline usage. And so what that means, what that translates to on a daily or monthly basis is that hospitals are sharing about 1 million status updates with each other and with different partners about helping create situational awareness every single month. So that's 1 million updates every month going through EM Resource alone. And because a lot of you probably have some sort of tie-in into some of the things that we're doing, wanted to make sure that we did a combination of an update on things that you probably would or your colleagues will see coming down the pike, and also things that we're really excited about launching. So in the position that we have in serving this market, we take very seriously our responsibility of investing in the future as we think through what it takes to more efficiently communicate and connect the communities in times of crisis. And so briefly talking about some of the things that are new for us and new as we share this. First, as the pandemic has waxed and waned, we've seen that there's a recurring desire for healthcare partners to lean in and bounce forward. So using lessons that you've learned or deficiencies that you've identified, there's an ongoing need to systemically assess hazards, threats, and potential business impacts. And with our capabilities and the perspective that we've gained over 25 years of supporting the response phase, we're now enabling institutions to prioritize plans and identify response objectives better in advance, which supports both visualizing and planning capacity from a top-down approach, and then also gaining insights on threats, risks, and liabilities from a bottom-up approach. So our goal is to continue to be the one-stop shop technology partner for planning, response, and recovery. And with these business continuity and solutions, our clients are standardizing the functions, services, and resources necessary to operate. So ranking restoration priorities, managing the continual improvement process for plans, and automating the dissemination of new plan versions, new checklists, seamlessly activating all of that together when the moment strikes. If you're in any of the states that currently use EM resource, and there are only a handful that don't, this is one thing that I'm super excited to share. It's been a few months in the making and based on a lot of client feedback. We are introducing EM Resource 4.0 to the market in just a couple months. And what this will have is a lot of user improvements, both from an user interface and navigation, as well as feature updates that will better able to support user profile, notifications, user management workflows, with the objective of making it easy to use the entire application and more efficient to do so. One thing that is very cool that's coming up is for states that use EM Resource already, going into the end of this year, next year, we'll be looking at how we can make it so that health systems have their private view of EM Resource and also the view of EM Resource that they share with the state, so that they can keep private information for internal system-wide situational awareness, and then the set of information that is shared with coalitions or states or rolled up to HHS. And finally, if you haven't been a part of this already, there are a few states that have chosen to deploy statewide API. And what that means is those updates that you need to send to HHS on a daily basis, most of them or a lot of them are automated through API. And so from a state or coalition partner perspective, they're getting updates every 15 minutes as opposed to every day because someone's keying data in. And when something needs to be flipped and sort of situational awareness is important for a time of crisis, that information is readily available. And certainly been one of the truly transformational things that has come out of COVID in the data velocity that's changing. And then one additional thing that has been super cool for us is the launching of Webeoc 9 for healthcare. So if you've used in the EM profession, Webeoc sort of in the state or local EM capacity, this is different because it takes some of those boards, which are our data and workflow processes, and configures them in a way that incorporates best practices from healthcare emergency management and provides something that can be used out of the box very easily in health systems. And so these are built so that you've got mobile responsive solutions, they have maps embedded in the workflows, and still using the robust information architecture of Webeoc, but with information that is appropriately shareable for an executive who may want something that's more high-level dashboards to folks that need to request resources that's more granular on the ground. So trying to really provide the right data at the right time, right depth of data as we grow into supporting more and more of the healthcare system use cases. And finally, a broad initiative across our firm has been just looking at how we do alerting and notifications. And as we think about them, they're really three different areas that we can focus this on. One is on collaboration and accountability. So if you're using EICS or live process, something for that. Second, for situational awareness. So thinking about this in terms of sharing data in a structured format, but also making sure that it stays in a way that you can then use for analytics later on to teach machines to do some AI and proactive predictive work. And then finally, mass communication. So we've done a lot of work for statewide HON alerts, and we've done a lot of work on workflow and sort of bridging that gap in the middle for a health system mass communication platform. Those are three broad themes that have been very, very excited about this year. And so if you haven't already, those are things to tap into. And then finally, for folks that we've worked with before, Javari Exchange for us is a really important concept and an idea. So in creating a mechanism for you to share information with each other, either on an ongoing basis or specific to an incident, and then being able to connect all that information and truly develop situational awareness, not just at a health system level, but also at a coalition level or a state level to different degrees of information as is needed based on the time. So we're putting a lot of work into this, and one area where it's already started to bear some fruit is where you've got state instances of Webeoc and local instances of Webeoc, and how we're able to eliminate some of the duplicative work by making it so that information from the county is able to go into the state without someone having to do duplicative work. So that's an area and the kinds of use cases that we're actually very excited to partner with clients and users on. So if you've got something that sort of fits that mold, let us know, and I'll make sure we put someone on working with you on that. And then I know probably up on time, so wanted to end with just saying thank you. A lot of names over here in organizations that we actually get to work with, and as I talk to my friends who aren't in the profession, who don't do public health and don't do emergency management, I get to describe the work that we do as the work of real superheroes. So really grateful to be here, and love the opportunity to come back to AHAP as a company and say thank you for all the work that you do.
Thank you so much for being here today.